an event is happening to bring awareness about appropriate antibiotic use. We're joined by pharmacist Lauren McDaniel with Carilion Clinic to talk more about what patients need to know. Good afternoon, Lauren. Thank you so much for coming in today.
Thank you for having me.
Now, we had the video just a few minutes ago, the Wells Fargo Tower all lit up in purple. Purple's very symbolic this month, right?
That's right,
Yeah.
yes. Purple is for antibiotic awareness and reducing antimicrobial resistance.
Okay, and you know, when we get sick, we want that quick fix. It's like, you know, you go to the doctor, your expectation is to get that antibiotic to make yourself feel better, but that's not always the way to go.
That's right.
Yeah.
And so your provider knows what you need, and so they want you to feel better. When you go to the provider, tell them about your symptoms, you'll tell them
Yeah.
about how long the symptoms have been going on for, and they'll know whether or not you have a viral illness or a bacterial illness. And if you have a viral illness, antibiotics are not indicated, but what they can do is give you symptomatic things that can help you feel better.
Right, and that's what at the end of the day we want. So
Yes.
we have dedicated this Antibiotic Awareness Week. So what are you hoping that people will learn from this?
Yes, I'm hoping that they will know that antibiotic resistance is a real thing and that any antibiotic use can lead to antimicrobial resistance, and we all have to work together. So it's the providers, it's the pharmacists, it's the nurses, it's the community of patients that we can all work together, reduce the antibiotic use and ultimately resistance in our area so that our kids and our grandkids can have antibiotics, because we know that antibiotics save lives.
Yeah, they do. And the last thing we want is to be overly prescribed antibiotics, especially when we don't need them in the first place, because antibiotic resistance can really lead to some serious conditions, right?
Exactly, yes. And we have seen patients that get antibiotic resistance where we don't have an antibiotic to treat them any longer. And so it's really important that we reserve it for those patients who do need an antibiotic.
So knowing this information, what can patients do to advocate for their own health when they go to the doctor?
Yeah, great question. I think when you go to the doctor, ask questions about, do you think my illness is bacterial in nature? Do you think it's viral in nature? And when they say that they think it's viral in nature, understand that you're not going to need an antibiotic. They're not trying to do harm by not prescribing you an antibiotic. And you can ask questions about how to feel better. So if you're maybe have some congestion, they can support you with a nasal saline spray, or they can give you maybe some Tylenol if you feel like you're having a headache or pain. So they can give you things to make your illness feel better in a timely manner.
Yeah, that saline spray works for me. I'm a big fan of that. It really does make a big difference. So in addition to, you're wearing lovely purple today.
Yes.
Of course, the tower's lit up in purple. What are some other things that we can do to help raise awareness this week?
Yeah, social media posts. So where the CDC has really great announcement posts that provide the community about education on viruses and when you don't need an antibiotic. And so if you feel comfortable, post the CDC's post and share with your family members about antibiotic awareness.
And I think really educating your children too, where it's like, you know, you want to get the right kind of medicine depending on what your condition is, and not just assume that it's, you know, antibiotic is a one-size-fit-all, because we've finally learned that that's not the case.
Correct. Yes, I think that's very important.
Yeah, and also being responsible when we're disposing of medications that we're finished with as well.
Yes, you can always bring them back to your drug take-back days with pharmacies, and make sure you're not keeping your antibiotics on the shelf for the next time you get ill. That's a really great piece of advice, is that sometimes patients want to keep their antibiotic and use it for the next time, and that's not a good idea. Go ahead and discard of it when you're done, or you should actually not have any antibiotic left, because you need to take it as prescribed.
Even as you're feeling better, you got to finish it.
Yes, you have to continue to take it until you've completed the entire course.
Yeah, all right. Well, some great reminders, of course, and people can always go online, right on Carilion Clinic, and learn more about antibiotic resistance.
Absolutely, yes. Yeah. Thank you so much.
And being aware of the correct use of antibiotics. All right, well, we appreciate you coming in, Lauren, so much.
Thanks.
Thank you.